Have you ever wondered, how many times a week do elderly people actually need to bathe? If you think the obvious answer is every day, then get ready because the truth may surprise you. We grow up with the belief that bathing daily is a necessity, a familiar routine like sipping a morning cup of coffee or catching up on the morning news. The feeling of cool skin, the subtle scent of soap in the air. All of this makes us believe that this is a symbol of cleanliness and health. But what if I told you that for elderly people, bathing too frequently can bring more harm than good? Let's set aside all biases and explore the little-known truths about the bathing habits of older adults. We will debunk misconceptions, delve into scientific research, and reveal secrets that could completely change the way you perceive personal hygiene. Are you ready? Because what you are about to hear may challenge everything you ever believed. Since we were young, most of us have been taught that bathing every day is the gold standard of personal hygiene. It's not just a habit. It's a ritual tied to a sense of cleanliness, freshness, and healthiness. For many, taking a morning shower is akin to sipping hot tea or reading a few lines of news, an indispensable part of daily life. This is not only a personal belief but also a societal norm. Whether you live in a bustling city like Tokyo, a peaceful town in the English countryside, or amidst the tree-lined streets of Sydney, the notion of daily bathing equals cleanliness is deeply ingrained in our thinking. It is an unstated rule, an obvious fact that few have ever questioned. But let's pause and reflect. Have you ever wondered whether this habit truly suits every age group, particularly the elderly? Is it always the case that bathing daily equates to hygiene and health? What many don't realize is that, just like dietary preferences or fashion styles, the need for personal hygiene varies from person to person. For older adults, the routine of bathing every day may not only be unnecessary but can also have negative effects. If you're telling yourself, but cleanliness is important for health, you are absolutely right. Yet the problem here is that we have become overly accustomed to equating the frequency of bathing with the level of hygiene, forgetting one essential fact. Does bathing too often indeed provide benefits, or is it subtly harmful to the body? Let's continue this journey to explore why daily bathing may not be the optimal choice for older adults. What you are about to hear may make you reconsider a habit you've adhered to for a lifetime. Scientific evidence and research. When it comes to bathing, we often rely on personal feelings and social norms to decide how often to wash. However, science tells a different story, especially for the elderly. Many studies have delved into this issue and revealed astonishing findings about the effects of bathing too frequently on the health of older adults. A study from the University of Pittsburgh found that the skin of older adults is more vulnerable when exposed too often to water and soap. According to this research, the epidermis of older individuals tends to be thinner and produces less natural oil compared to younger people. When bathing daily, this protective oil layer is washed away, causing the skin to become dry, itchy, and prone to cracking. These cracks not only cause discomfort but also create favorable conditions for bacteria and fungi to invade, significantly increasing the risk of infection. Another study from the University of California, San Francisco, came to a similar conclusion. Researchers found that older adults who bathed daily, especially with hot water, were at a higher risk of developing severe dry skin, known as xerosis. This condition causes the skin to become flaky, sensitive, and sometimes painful. Not only does frequent bathing affect the skin, but it can also lead to more serious issues. According to an article published in the New England Journal of Medicine, older adults who bathe less frequently actually had a lower rate of skin tears. Minor skin injuries may take longer to heal as age increases, significantly raising the risk of infection and ulceration. But the problem doesn't stop with the skin. The American Geriatric Society emphasizes that daily bathing can pose a serious safety risk for older adults. The bathroom is one of the most dangerous areas in the home, where slips and falls can occur. A report from the Centers for Disease Control and Prevention (CDC) indicates that nearly one-third of people over 65 experience fall accidents each year, with most of these incidents occurring in the bathroom due to slippery floors and wet surfaces. In addition to the risks related to skin and safety, bathing too frequently can also lead to fatigue for the body. A study published in the Journal of the American Medical Association, JAMA, found that activities such as standing for long periods, bending, scrubbing the body, and exposure to hot water can make some elderly individuals feel dizzy or fatigued after bathing. This is especially true for those with blood pressure issues or difficulties maintaining balance. These findings do not mean that older adults should completely forego bathing. They simply indicate that daily bathing is not the appropriate standard for everyone. By better understanding the impacts of this habit, we can adjust our personal hygiene practices to maintain cleanliness while optimizing health protection. But if daily bathing is not the ideal solution, what is the appropriate frequency? Let's explore the answer in the next section. Revealing the shocking truth. And here is a truth that may completely surprise you. Experts do not encourage elderly people to bathe every day. In fact, many dermatologists and geriatric specialists recommend that older adults should only bathe 1 to 2 times per week. That's right, you heard it correctly. Only 1 to 2 times a week. For many, this idea may go against everything they have ever believed about personal hygiene. Since childhood, we have been accustomed to thinking that cleanliness means bathing daily. However, when we look deeper into the actual needs of the body, especially for older adults, we can see that bathing too frequently may not be necessary and could even be harmful. Let's consider why this advice is reasonable. As we age, the skin becomes thinner, produces less oil, and is more prone to dehydration. Frequent bathing, especially with hot water and harsh soaps, can strip away the natural oils that protect the skin, leading to dryness, irritation, and even increasing the risk of skin infections. Excessively dry skin not only causes discomfort but can also create small cracks, reducing the body's natural defense against bacteria and fungi. Additionally, safety factors are also an important reason. The bathroom is one of the most dangerous places for the elderly due to slippery surfaces and a high risk of falls. As age increases, the ability to maintain balance diminishes, making movement in the bathroom a challenge. Even a small slip can result in serious injuries such as hip fractures or traumatic brain injuries. Therefore, limiting the frequency of bathing not only helps protect the skin but also significantly reduces the risk of accidents in the bathroom. Moreover, some studies have shown that bathing less frequently may help maintain a balance of beneficial bacteria on the skin. Our bodies harbor not only harmful bacteria but also a variety of beneficial bacteria that help maintain skin health and the immune system. Bathing too often can inadvertently wash away these beneficial bacteria, reducing the body's ability to defend itself against pathogens. Of course, this does not mean that older adults should completely neglect personal hygiene. Instead, cleaning the body should be done in a way that suits actual needs. If bathing less often is good for health, how can personal hygiene be maintained without bathing every day? This is an important question that we will continue to address in the next section. Explanation of the reasons. So why do experts recommend that elderly people should bathe less frequently? The answer lies in the very changes that occur in our bodies as we age. Human skin has a natural protective mechanism thanks to the layer of oil and beneficial bacteria living on the surface. These components help to maintain moisture, prevent harmful bacteria, and protect the body from infection-causing agents. However, as we age, the process of producing this natural oil gradually decreases. This means that the skin of older individuals becomes drier, more prone to dehydration, and more sensitive to external factors. Bathing too frequently, especially with hot water and harsh soaps, can destroy this natural protective barrier. When the oil layer on the skin is washed away, the skin becomes dry, tight, flaky, and may even crack. These tiny cracks create ideal entry points for bacteria and fungi, increasing the risk of infections, irritation, and skin diseases such as eczema or contact dermatitis. In addition to skin issues, frequent bathing can also affect the circulatory and respiratory systems of older individuals. Hot water temperatures can cause sudden fluctuations in blood pressure, especially for those with cardiovascular diseases or low blood pressure. Some may feel dizzy or lose their balance immediately after getting out of the bathtub, increasing the risk of falls. When combined with slippery wet floors, this can become a serious hazard. Moreover, many elderly individuals have difficulty with mobility. Standing under the shower for long periods, bending down to scrub, or stepping into the bathtub can become a challenge for those suffering from arthritis, osteoporosis, or loss of muscle strength. These seemingly simple movements can cause aches, fatigue, and even drain their energy after bathing. For this reason, many doctors encourage elderly individuals to choose gentler methods of body cleaning instead of daily bathing. Furthermore, the immune system of older adults also functions less effectively than when they were younger. When the beneficial bacteria layer on the skin is washed away due to excessive bathing, the body loses an important layer of defense. This can cause the skin to become irritated, itchy, and increase the risk of developing chronic skin conditions. However, not everyone can follow the same bathing frequency. Some individuals still need to maintain personal hygiene more frequently due to personal health conditions, such as those with diabetes who have a higher risk of skin infections, or those who experience excessive sweating. Therefore, rather than adhering to a fixed standard, elderly individuals should adjust their personal hygiene habits based on their body's actual needs. If daily bathing is not the optimal choice, what are some ways to maintain cleanliness while still protecting health? In the next section, we will explore effective hygiene methods to help elderly individuals feel clean and comfortable without having to step into the bath every day. If daily bathing is not the optimal solution for the elderly, how can they maintain personal hygiene while also protecting their health? In fact, there are many effective ways to keep the body clean without frequent exposure to water. The important thing is to find a method that suits each person's needs, ensuring hygiene while minimizing risks associated with overbathing. One of the simplest methods is to use wet wipes or warm, damp cloths to clean oneself. This is an effective alternative that helps remove dirt and bacteria without stripping the skin of its natural oils. Areas prone to sweating, such as the armpits, groin, neck, and feet, should be wiped clean daily to prevent bacteria growth and unpleasant odors. Additionally, changing into clean clothes each day plays a significant role in keeping the body feeling clean and fresh. Clothes, especially underwear, can absorb sweat and bacteria, so wearing clean clothes helps minimize dirt buildup and skin irritation. Furthermore, regularly washing bed linens and pillowcases contributes to maintaining a clean sleeping environment, reducing the risk of bacteria and mold affecting skin health. Taking care of the feet is also an important part of personal hygiene. Elderly individuals, particularly those with diabetes, need to pay special attention to keeping their feet dry and clean to avoid the risk of infection. If daily foot washing is not possible, using wet wipes to clean them and changing socks regularly can help keep the feet fresh and dry. In addition to body cleanliness, hand hygiene plays a vital role in preventing bacteria and protecting health. Seniors should wash their hands frequently with soap and warm water, especially after using the restroom, before eating, and after touching public surfaces. If water is unavailable, alcohol-based hand sanitizer is also an effective option. Another aspect of personal hygiene that many people often overlook is oral care. Brushing teeth at least twice a day and using dental floss helps prevent gum disease, bad breath, and other oral health issues. For those who wear dentures, properly cleaning them is crucial to avoid bacterial infection. Moreover, using suitable moisturizing creams helps maintain skin moisture, reducing dryness and itching. Applying moisturizer after wiping the body or washing hands helps keep the skin soft and healthy. Choosing skincare products without harsh chemicals or fragrances can reduce the risk of irritation, especially for the sensitive skin of the elderly. To substitute for frequent hair washing, dry shampoo can be used, or simply using a damp cloth to lightly wipe the scalp can help remove dirt. This helps maintain clean hair without frequent exposure to water, which is particularly useful for individuals who have difficulties bathing. Maintaining personal hygiene does not necessarily have to be linked to daily bathing. With appropriate alternative methods, the elderly can protect their skin health, reduce the risk of infection, and ensure their bodies remain clean without facing the negative effects of overbathing. However, more importantly, it is not only about maintaining hygiene but also about leading a healthy lifestyle that allows the body to feel comfortable and energized each day. In the final section, let's review the most important points and draw lessons on how to care for personal hygiene reasonably and scientifically.